Thanks for attending today and welcome. My name is Rodney Matos, Director of Sales for Premier Access Insurance Company, and I'll be your presenter this morning. We've designed this short webinar to quickly introduce the Integrated Fully Insured Supplemental Medical Expense Plan. You may be asking yourself, what is a fully insured supplemental medical expense plan? And that's a great question. PremierMed is a great new product brokers are calling the best client saving strategy they've ever sold. In fact, PremierMed potentially saves employers between 10 and 20% in premium costs with no risk. And because our product is so flexible and easy to use, employers enjoy these savings while maintaining and even improving current benefits. If you have already researched other supplemental medical or gap plans, you know they typically have many exclusions, are limited in flexibility, and are difficult to explain to your clients. Most gap plans just don't fill the gaps. PremierMed is different, and our strategy is so simple you can explain it in 10 minutes or less. What is an insured supplemental medical expense plan? We realize you're looking for solutions that meet employers' needs in providing a comprehensive, affordable medical plan for their employees. The difficulty with the Affordable Care Act leaves brokers with fewer plan choices offered by carriers to meet those needs. Why get stuck with an off-the-shelf insurance product when you can use PremierMed to design a plan that truly meets the needs for your clients at a lower cost? Known as the PremierMed plan, this increasingly popular strategy helps employees guard against the financial risks associated with paying out-of-pocket medical expenses. And our insured PremierMed plan pays you higher commissions than the typical medical carriers. How it works. Step 1. First, drive down the cost of the traditional medical plan by finding a high-deductible major medical plan, like a bronze plan, with doctor office visits and prescription drug copays, as these are the services most often utilized by employees. Step 2. Add our insured PremierMed plan to backfill the increased deductible, coinsurance, and maximum out-of-pocket. Our plan's flexibility allows you to design the plan that best meets your client's benefits and financial objectives. Step 3. You now have two plans, keeping the benefits the same or even improving coverage for the employer and their employees, all for less money. And the insured PremierMed plan is acceptable with most major medical carriers. So let's take a look at an actual case so you can see how it works. Here's a sample company. This is a 28-person group currently offering employees a $500 deductible plan. The single max out-of-pocket is $3,500. Their monthly premiums are almost $26,000. To save the employer premium dollars, the broker recommended moving to a $2,500 deductible plan with $6,250 out-of-pocket maximum, along with an insured PremierMed plan. The results was an annual savings of over $45,000. The employer saved money without risk. The employees eliminated their deductible, have a lower out-of-pocket max, and the broker earned commission on both plans, the major medical and the insured PremierMed plan. So, this sounds too good to be true? What's not covered? First, we don't cover the insured's copays that are $100 or less. All copays above $100 are covered. Second, we don't cover outpatient prescription drugs, although we do offer a rider to cover outpatient prescription drug deductibles. But remember, both office visits and prescription drugs are usually handled by the medical health plan copays, so they are really a non-issue. Also, chiropractic and outpatient mental health are excluded. Other than that, all services covered by the underlying medical plan are covered except for chiropractic and outpatient mental health. A copy of the group policy is available for review upon request. PremierMed can be paired with fully insured PPO and HMO plans for groups with 5 or more employees. Let's take a look at tailoring PremierMed for your client's needs. First, choose a percentage ranging from 50% to 100%. Next, select a benefit ranging from $500 to as much as $10,000 per employee per year, very similar to the structure of our dental plans. Benefits are limited to a maximum of 2 times per family, so they are aligned with most medical plans. Additionally, you may choose to add an RX rider to the insured PremierMed plan. The RX rider allows for a separate benefit of $100 to $2,000 to cover the deductible for prescription drugs. The RX rider percentage must be the same as a supplemental medical plan benefit and is available to a maximum of 90% coverage. Also, an important note, a RX rider is required for any RX deductible reimbursements, even when PremierMed is offered with an HSA plan. So how do you get an insured PremierMed quote? Just use a supplied rating disc and follow simple steps for generating your very own proposal. No sending in plan information or census required. And there's no waiting for a proposal to be sent back to you. It literally takes less than 3 minutes to prepare. The PremierMed rating disc is simple to use and allows you to optimize the best plan pairings by maximizing premium savings for your clients. Just enter in the underlying medical plan deductible, select the insured PremierMed plan maximum, select the insured PremierMed coverage percentage, select yes or no for the RX rider, select the RX rider dollar amount, select new or existing Premier Dental and Vision client. The reason for this is package discounts apply when packaged with dental and vision. Are you enrolling members into an HSA plan? Select yes or no. Enter your census information, then optimize the options with your high deductible health plan, and when you're finished, print and save your rate sheet. And that's it. Key advantages of working with Premier Access include you and your client receive a single point of contact for your supplemental medical, dental, and vision plans. Your account manager is your direct link for any items concerning enrollment, eligibility, claims, etc. for all 3 lines of coverage. Basically, one call does it all. And with consolidated billing for all 3 lines of coverage, billing reconciliation is simple. The PremierMed Supplemental Medical Plan pays you a level 13% commission. Additionally, you'll receive a package discount when combining multiple lines of coverage. New business to Premier Access on dental and supplemental medical will include a 5% discount off the manual dental rates and 5% off the PremierMed rates. If the client is currently a Premier Access Dental and Vision customer and you want to add the PremierMed plan at renewal, we will take 5% off the supplemental medical plan rates.